Oh, great. Okay. And now to the slideshow. Great. Okay, and you can all see the slides.
Yes.
Okay, great. Okay, so
I'm
sorry
going
for the
to,
technical difficulties. It's great to be here. Um, so this is a lecture about long distance medical Qigong. And so I'm going to just talk a little bit about me, the historical origins, the scientific discoveries, um, what is medical Qigong in some cases, basically. So my background, I have doctorate in Chinese medicine, master's in Chinese medicine, three masters in psychology. I've taught and created an institute, so teaching background, spiritual background because it pertains to medical Qigong. So I have a whole career as spiritual teacher healer, and all of the list um, of the things that I've taught or practiced are all energetic. In the last discussion, we were talking about resonance, and I'm going to talk further about it, but it is critical to qigong and to particularly long distance healing. The transcendental essences and transcendental acupuncture that I created and use operate entirely on resonance. So I'm going to talk more a little bit later. What is qi? So if you rub your hands together right now, pull them apart a little bit, you feel something between your hands. That something is qi. And in Chinese, Qi Gong, Gong is practice or cultivation. So Qi Gong is a practice and cultivation of Qi. The closest term in English is energy. It's not a very, it doesn't really cover what Qi is, but this closest we come in English. So the history, archaeological evidence links Qigong to shamanic practices, meditation, and movement 7,000 years ago. So when I was in school, they say the Bible of Chinese medicine is about 2,500 years old. But since then, discoveries from Mawangdui, which is a burial site, they actually recovered um, uh, a, a picture of a shaman in a meditative state and practicing Qigong. They also discovered pieces of written um, pieces of the Bible of Chinese medicine, the Huangdi Neijing, 7,000 years ago. So shamanic, the character for doctor in Chinese comes from the word shaman. So medicine is from shamanism, but also Taoist beliefs and understanding of the universe have to do with shamanism as well. So, in terms of Qigong practice, there was a Confucius brand of Qigong tradition that came out of moral training. There was a Taoist brand of Qigong practice that was about physical cultivation and also access to higher realms of existence. In other words, consciousness. So the understanding of Qi as part of consciousness goes thousands of years back. And then a Buddhist brand of Qigong, meditative and also having to do with martial arts, sort of the basis of Shaolin martial arts. In the 50s, there was a famous book by Liu Guizhen, Gong, Qigong Liao Fa Shiyan, um, that that publicized how Qigong is part of healing disease. And this book and the government's wanting to incorporate it, they created Qigong departments in traditional Chinese medicine, departments in universities and hospitals, which really made fertile ground for the development of medical Qigong. By the 1980s, there was about 1/5 of the Chinese population practicing Qigong. So again, Qigong is the general popular practice of aligning breath, movement, and awareness for general healing and physical well-being. And then eventually Western societies began to incorporate some of these philosophies and practices. Tai Chi is another example. It's a martial art, but it's an example of using Qigong, and it has documented in Western culture, Tai Chi is documented as helping physical improvements, physical health, and I've listed that, but you can go and look up NIH, a lot of studies documenting the benefits. So the general practice of Qigong, there have been remarkable claims about self-enlightenment, about expansion of consciousness, out-of-body experiences. Both Buddhist and Taoist practitioners have documented miraculous powers when used not just for physical, but also for spiritual cultivation. The martial artist, Effie Chow is a very famous Qigong practitioner in the United States. She recently passed. I went to one of her presentations where she had 8 big men on the stage, and she went up to them and merely touched the shoulder or chest of the first man, and all 8 of them went down to the ground. That is a use of Qigong after a lifetime of cultivation. So the scientific background. So vibrational healing or resonance healing is both an ancient and emerging field. So recent discussion is talking about one of the German pieces of equipment and uses, but there are many different kinds at this point in time, because Western medicine, particularly through quantum physics and quantum mechanics, is beginning to really understand on a scientific and mathematical level the existence of unified fields and frequencies and how resonance works with all of this. So basically, Western medicine is catching up with thousands and thousands of years old ancient understanding of the universe. So this presentation is going to explore the energetic, vibrational, and resonant foundations of healing, including prayer, distant healing, and consciousness interaction with reality. Unified field is basically all forms of energy create a single framework. So everything in the universe is an expression of an underlying field. Okay. And frequency is the rate at which a vibration or wave vibrates, right? So everything from sound and light, brain waves, emotions, all have frequency. Resonance can work because of frequency, and there are different frequencies that you would resonate at. So health would be harmonic vibrations or harmonic resonance, and illness would be disharmonious. So in quantum physics, the unified field is the connection of everything. Frequency is how that interconnection is expressed and modulated. And vibrational healing uses resonance to restore coherence in the system. So in the previous discussion, the patient walked in with body full of pain with inflammation, and that tool created a coherence in the system that instantaneously resolved pain and inflammation. So the kinds of vibrational therapies or resonance therapies are way more than I have listed. But these are just some examples because sound, light, color is light, frequencies, I've used all of these and more. Um, can can basically an explanation would be, if you can see, I don't see, you can see. Okay, if I'm holding a tuning fork in one hand, not moving, just holding it, a second tuning fork in the other hand, and I hit the second tuning fork, so it emits a sound and it's also vibrating. The first tuning fork will begin resonating with it at the same frequency. That is resonance. And that is how much of all of this works. So, so homeopathy is vibrational imprint in water, and that will resonate with the body, and the body will tune into that. That is basically how my transcendental essences will work. Acupuncture is basically resonant therapy. Reiki, which, by the way, the Chinese characters for Reiki is spiritual Qi. Qi, translated English, is energy, but it's that which is in the unified field. So it's spiritual level of that Qi. And Reiki is, with good intention, sending that energy to another being. So you can do that in front of the person, or you can do that long distance. Distance is immaterial. So, so what long distance medical Qigong is that with the information of Chinese medicine, which is extremely sophisticated. So with auricular medicine, which is a branch of Chinese medicine, for instance, how specific and sophisticated it is. I had a patient that had a bleeding disease. And so he would, I'm not a Western doctor, I can't say it in Western language, but he would have a little, I think it was the blood vessels would burst, but he would have a little tiny blood vessels would burst, and there would be bleeding, and it could happen anywhere in the body. It could happen on his lips, and I could actually see it to heal it, but it could also happen anywhere in the interior. And with auricular medicine, I could needle the ear and stop bleeding anywhere in the body. And so if he had one of these things that the only way to stop it was to cauterize it, I could actually stop the bleeding with the ear, either on the lip or internally. So, and that, so that is the sophistication of Chinese medicine and acupuncture. Long distance is sending that information to the body. So in other words, my patient who is long distance, sending those acupuncture points stimulation on a resonant level, vibrational level, at any distance. It could be in front of me, it could be in India. It's the same. So this is an AI translation of the idea. So it's not really accurate, but you can see the meridians of energy, the rivers of energy through the body, and the points are points where there's more of that energy, meeting points in the body. So acupuncture is manipulation of the qi in these meridians, so it is energetic. So further reading, there's a little bit of a list. So anybody is watching this, they can stop the recording. And all of these are written in lay language. So talk about the field, about energy medicine, about morphic resonance, about the conscious universe. So, the ancient ideas of consciousness with qi in modern terms. Candace Pert, Molecules of Emotion, is talking about how the emotion affects the immune system, and they've done so many studies. So if you go to the NIH, you can look up a lot of studies on all of this. Things they are saying now, the biofield is not mystical, but a real measurable energy field. So all of what I'm talking about, which used to be thought of as woo-woo and all had to be believed, is not mystical. Science is now catching up. They can measure it. The human body emits and responds to electromagnetic fields. When the field is disordered, illness manifests. These are things were said in Chinese medicine thousands of years ago. And when I was studying, they would say, oh, Chinese medicine is so poetic. It is not poetic. It is actual. It is talking about real things. Distant healing and prayer represent a non-local extension. So whether the healing is immediate or at a long distance is immaterial. It's the same energy and same resonance. So Elizabeth Targ did research on cancer patients and prayer. So same treatments with both cohorts. The treatments that received prayer, which is a kind of distant healing, had significantly better outcomes. So just to sum that up, the unified field is a source field connecting all reality. The vibration frequency is the vibration that expresses health or imbalance. Resonance is the mechanism of healing through entrainment, and consciousness allows that to happen at any distance. So again, Medical Qi Gong is taking that qi and applying it with a sophisticated knowledge of the body and energetics and how to move qi to create physiological effects like stopping bleeding. So acupuncture is the study of function and physiology of qi in the meridians of the body and the manipulation of this for healing, right? So that's what medical qigong practice is. So let's see. So the Huangdi Neijing talks about medical qigong, and it talks specifically about the cultivation of the superior doctor. You can treat disease at the level of symptom relief, or you can treat disease to go to the root. And the root of all disease is spiritual. In other words, on these levels of harmony or disharmony. And in order to reach these kinds of levels, the doctor has to cultivate a lifetime of qi practice so that they understand physiological levels and spiritual levels and how to achieve right relationship between the doctor and heavens or superior moral and spiritual qi and the environment, and also the patient's right relationship of their nervous system and their qi and their spirituality. skip this one. So I've already explained how Reiki is kind of a generic, good intention healing, or faith healing would be the same, and how medical Qigong is a much more sophisticated version where it's sending energy very specifically to have specific results. And so this is a better picture of how that might look in our imaginations. So the practitioner is sending specific energy to specific points to create specific results. So I can do this in person, but the first time that I was doing it long distance, I had a patient whose son was in prison and she wanted to help him. So I said, I can do this treatment, and if it works, you can pay me. If it doesn't work, you don't have to pay me. And so I worked on, I think the first problem was the back problem, and the patient paid for several treatments and resolved that problem. And then maybe 6 months, a year later, the same patient came back with her son had a knee problem still in prison. And so we worked on that. But I have worked with a lot of people since then, people and animals. So this treatment, I'll talk about animals because it shows that with babies, with animals, it is not a placebo effect. They don't need to know that you're working on them. They don't have to believe in what you're doing. For ethics, I require that whatever I'm working on has my permission, so they know that I'm doing something. But belief is not required. It is an energetic, it is a resonant thing that, yes, you can get instruments to create resonance, or you can develop your own body as the instrument and do the similar work. So how does it compare? Well, I have found that I get the same results long distance as I would with needles in the clinic, but a few small differences. Doing it long distance takes more of my chi or my energy, and the results for the patient are not as instantaneous and dramatic. So in the clinic, I can have somebody with frozen shoulder put a couple of points in, and they can instantaneously raise their whole arm. I can get really dramatic, instantaneous results in clinic with needles. Long distance, you can get the same results, but it may take a little bit more treatment or a little bit more time. And one of the benefits is more convenient and comfortable for patients, especially during the pandemic. People didn't have to leave their homes. It's convenient in that way. And people that don't like needles, it's a relief. So talking about some cases, there was a 15-year-old boy with 4 years of very severe TMJ so that they could barely get food in. And it was very painful to eat in any way. They ate through a straw and it was painful. And they had 4 years of this. They also had a history of depression, and they were working with a therapist. They had anxiety and panic attacks now reduced. They had worked with the therapist for 5 years, but they were still having these symptoms. So after 6 long distance medical treatments that had improvement after each treatment, they were enabled to insert their whole hand with no pain, no tension. I also gave them 4 weeks of homeopathy, transcendental essences, which had dramatically positive results on their emotional system and their social interactions and so on. So they had more confidence, no more panic attacks, and overall sense of well-being. Um, so, um, so this is just saying if I only treated the physical problem, my belief is that it could recur. But because I work with the physical and emotional, spiritual, this patient did not have a recurrence of this issue at all. They had an anal tumor case. The person was out of state, couldn't get into the clinic, and they were already scheduled for surgery. And so I really am not going to say about cancer or no cancer, just tumor. Um, so they were scheduled for surgery. I did one treatment. They went in for their surgery as scheduled, and upon examination, there was no more tumor, and everything was resolved, and it did not recur. I talked about the prison case. I'm going to talk about a couple of animals just to show that really it is not placebo effect. Not that I have anything against placebo effect. If this was entirely placebo effect, I would be thoroughly happy. I just want to say that it isn't, because it works on animals and babies, children. So there was an older cat with incontinence, probably diabetes, but anyway, I was just told about the incontinence, and I had one treatment resolve the incontinence for about a month, and then it returned in milder form. If this cat was untreated, it probably would have come back entirely. So I was recommending herbal treatment to continue. I had an old dog that was the vet was prognosis was like 1 to 2 months it was going to die. The dog was dazed, confused, dragged the whole right side, drank enormous amounts of water, and was just not recognizing the owner and interacting. After the first long distance treatment, the dog went into the garden, found a twig, and was playing for the first time since the illness. After the second treatment, there was no more dragging on the right side. The elimination was reduced at least by half, and the frequency was reduced. The dog would look into the owner's eyes and was present, and way less discomfort. A 79-year-old female had the right foot swollen into the calf area. The skin was red with raised welts, oozing lesions from scratching, and the skin itched incessantly. The left foot was starting to have the same condition. During the treatment, the patient could see the fiery red skin become dull, and the swelling and the color reduced, and the itching stopped. The next day, both feet radically improved, reduced swelling, and the red color was almost gone. There was no more itching. Works for shoulder and neck pain pretty easily. A snowboarding accident, landed in the snow. She had 15 months of periodic pain and occipital headache, worse with stress, worse with working on the computer. Immediately post-treatment, her pain was reduced to a 2 out of 10 range of motion, 2 out or 3 out of 10 pain. So whereas in clinic, I might have that reduction immediately after I put the needles. With a long distance treatment, I might find that kind of progress post-treatment. So they need 30 to 40 minutes to assimilate the treatment. And the next day, the pain was back a little bit, but reduced from what it had started out as. 9 days later, zero pain, zero headache. They had a vaccine which induced severe headache, but the shoulder was still okay. So basically, the results of long distance Qigong are the same as in person. They're useful for people that can't come into the clinic or don't tolerate needles. And you can also do it in clinic. So sometimes babies or children, if they don't tolerate needles, if they don't tolerate laser, then I can do just long distance healing right in the clinic. It's also used for autistic or disabled patients that might be excitable and it's hard to have them present. They can be worked on long distance. So that is the sum total of the presentation. And I'm open for questions. And that's my contact information. So my website is very old and bad, but I'm working to update it. And my phone number and email still works. So I will stop sharing. And I'm able to answer if there are any questions.
I have a question.
Yes.
My question is, do you find that doing therapy, distance therapy, takes more energy?
Yes. Yes.
How?
Yes.
Yeah. How do you? Because we can do that with resonance. Like if you have a device, let's say the device that I have, I can do. I can send homeopathic remedy with that homeopathic remedy inside the device because there is a glass beaker.
Great.
Or flower essences.
Yeah.
And or let's say somebody has pain. I work with the resonance with the photograph of the patient, if they sent me that, where I have the input and then the output. And I don't want, and I do also acupuncture, but I will not use acupuncture. I will use acupuncture with a homeopathic remedy when somebody comes in on their body, because
exactly.
I dip the needle in the homeopathic remedy that I, you know, energetically and knowing the remedies and their emotions and all that. But the reason I have this device and all the information, as you say, that you do the work like this, distance and in your clinic, is because I noticed I had no protection for myself, and I would get, let's say, giving the energy, sending the energy. But if somebody is in a village and they have a problem, I just think of the homeopathic remedy and energetically I send it to them because they have no way of getting the remedy, you know? Or a patient, I tell them to write it on a piece of paper and stick it on their body. And it works.
Yes, it does.
So, you know, I just want to say that this is an old way of working.
Yes.
But the therapist has to be open-minded. And, you know, the thing is, the intention.
Yes.
Is the most important thing, and doing it with love.
Yes, but I agree with it, but it is also the cultivation of the doctor, of the practitioner. So intention is vitally important. But if you only have intention and you don't have cultivation, then your results are not going to be as as impressive. They're not going to be as good.
It's true. It's true
And
because you have to use that, and you have the belief.
it's not
The
it's not just belief.
vibration.
It's the vibration. It's not
Yeah,
belief.
it's the vibrations that you work with, like
It's the vibrations that you work with. It's not
the
belief. It's
yeah.
there's an expression that the teacher can only take the student as far as the teacher's development. That is about vibration, and that also expresses this. So the practitioner's cultivation or their level of understanding vibrationally is what sharpens that ability to send it.
Yes.
But it's not the means of sending it. So whether you have it on a piece of paper written or whether you have on a very expensive instrument that can send it, it's about the resonance. And if you can get that resonance, then you get the healing. And the person receiving it, I have never tried it on somebody that doesn't know or isn't willing because it's not ethical. So I'm not going to do that. So anyone I'm treating is because they are open to it, but not necessarily that they believe in it. I have treated quite a few patients that don't believe. They don't have to believe.
Ethically, of course, they need to know because
They need to know because
of
they have to
course.
be receptive because I'm not willing to impose
Sure.
my anything on anyone. So that's
It's the only way.
ethical. But yeah. Okay.
Thank you
Thank
so
you.
much for your
Thank you very much.
presentation. It's nice to hear other people are working on this level.
Yes. Thank
And
you.
congratulations for being able to explain it.
Thank you. Thank you. Any other questions? Okay, great. Thank you so much for the opportunity, Nawaz. And if you could send me the recording, I would so appreciate it. Thank you so much.
Thank you again.